There we go. So this is our mantra, right? So now I go a little bit in the tool and explaining you. So what we hope to do here, so I just want to come back also why we're here. So first of all, be smart. So we had a conference, so we tried to do as much as possible while we're in Canada. So we tried to put it together, so thanks for making this time. But what we really want to do is that everybody becomes a data scientist. So who knows data scientists, what it is? A data scientist, yeah, some of them. So this is one of the jobs of the future, right? Big data, how to do this. So I'll explain you a little bit how we explain big data, also to our customers, our leads, our prospects, and then we'll go into the tool, and then Philip will take over. So again, the why I already explained, sorry for that. Probably that slide shouldn't have been in there. I was also unexpecting it. My slides, my mistake. Shouldn't blame anybody for it. Oh, thank you. So volume, data volume. So there's a lot of data. Who's searching like for your job 1 hour or less per day? Who's searching 1 hour to 3 hours per day? And who's searching more than 3 hours per day for data? So indeed, that's pretty consistent with how you do. So if you search for data, you're a data scientist. So you bring together, you make reports, you're a data scientist in a certain way. Of course, data science is more than that. You need to learn about statistics and other stuff. But big data is known of the 4 V's. Who knows the 4 V's of big data? Ah, good. So it's a buzzword, right? But you need to also go with the flow in what people are saying. So first of all, it's volume. So volume means there's a lot of data. This is how it looks like, data. It's growing organically, and it's a lot of data. So you cannot handle it. So it's impossible to handle it. It's very difficult. Only few companies do that well. Then next to that, the second V, velocity. So think about next-gen sequencing. Probably you know about next-gen sequencing here. So sequencing, 10 years ago and now, pretty different, right? How quickly and at what price do you get it? Think about 23andMe. Think about what Foundation Medicine and other companies are doing. Sequencing goes extremely quickly and is much cheaper. But how are you going to handle that data, the velocity? So the data is not only more data, but more quickly. It comes far more quickly. Think about wearables, right? All these wearables, where are we going to catch all of that data? And this is not just one data set, but it's on a daily basis, right? All the patient data, all the sensor data. How are you going to manage that? Next to that is, oh, sorry, I'm going back. I'm not using this. This is how people talk about silos. So these data islands. So the data is not connected. Think about when you search for data. You search for drugs or pharmacology issues, and then you go to Drug Bank and Campbell and other tools. One calls a compound. In another tool, it's called ingredient. Then it's called drug. It has an active ingredient, whereas the compound is the active compound. So the semantics are not right. And all of these data islands are really badly connected. So this is a problem which we call variety or variance of data. It's not well connected. The third V. Then we have the fourth V, veracity. Veracity, I don't know if I pronounce it well, but we pronounce it in Belgium veracity, but anyhow. So veracity, what does it mean is, if you do searches, so people doing searches here, you have multiple screens open. You have like this Google screen open, and you go back, and then, oh, URL, interesting, on the screen, oh, I'm going to look it up in PubMed, publication. Oh, I need to go to Uniport for that protein, or over there. And you have all these screens open, and you paste it in. So you got a nice report, and this is where we want to help you, by the way. We want to help you with this, right? You can help us with feedback, we can help you with your research. So let's do that. So where we want to help you is, if you have this search, and you want to redo it 1 month later or 2 months later, how difficult is that? Did you know what sites you went to? Did you know what database you went to? Can you redo that? It's tough. So redoing with the same quality your search after a time is part of veracity. And the other part of veracity is the fact that, you can arrange it, is the fact that, do you know where the data comes from? So you grab all of this data together, but do you know what sources it comes from? So to be able to tell after some time, or to tell with your colleagues, how this data comes from high quality or low quality, where does it come from? So you could call it auditability of data. This is veracity of data. So these are the 4 V's of data and the 4 V's of big data. So can you still find your way in all of this data? It's a challenge, for sure. So we try to give a solution, and we want you to test the solution and tell us if it works. So what do we do, first of all, and I think also in scope here, is public data. So we grab all of the public data you want, and Philip will explain you what sources are in there. It's also enabling translational science. Who's here active in the field of translational science? Not a lot. Okay, that's probably for later then. But translational science means science from bench to bed and bed to bench. So it's like the valley of that between healthcare and life science, making a drug and what happens with the patients. And the patient is in the middle. How do you connect the data? How do you relate what's happening in a clinical trial to early research? And what target in the human body is creating the disease? What is the right drug? And so on. How do you map all of this data? So we have a lot of public data sources in there, and Philip will explain that later, and we try to bring it to you in an easy-to-use way. Because this is the problem, and probably more people in companies will know this better than the universities because you don't have these tools at hand, but one thing is you have dashboards. So business intelligence, BI stands for business intelligence. You have dashboards. So dashboards are meant to create an IT tool that helps you easily interpret things and reinterpret it and being able to do this in a quick way. But once you want to change it, you have to go back to your business intelligence team or your IT, and it takes time to get it back. It takes money to get it back, so that's not right. So the other aspect, which more in life science a lot happens, is what we call the data scientists, the bioinformaticians, the chemical informaticians or cheminformaticians. They dive deep into these sources, they dig it out, and they will bring you a booklet of all your information on your target or your drug or your mechanism of action. So how many data scientists are there? How many bioinformaticians do you have? What's the cost of these people? And if you want a report, how much do you pay for it? So they become a bottleneck. And what do people do when they do research? They Google. So this is the gap. People Google. And Google is the best resource. And this is also where we say, again, coming back to Renzo and how it all started, when you Google, can you trust the data? Is this quality data? Does it cover the PubMed data, the pathway data, these kind of things? Not always. And this is where we want to give an answer. We want to create a Google for biomedical data. Okay? So we use a semantic web approach, a little bit of technology. Who knows semantic web? Ah, there you go. Cool, 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 cool. So semantic web, what does it mean? First you had Web 1.0, the web of documents, HTML, so people know HTML. So the keywords are in there, you need to search for the keywords. If the keywords are not in there, you won't find it. If it's not ranking up high because it's not well feed for the bots, or you don't pay for high ranking, you won't get it, right? So think of Google, it's great, but it's probably more an advertisement engine than it is a search engine. So can you find it? So then secondly, first we had the HTML and you had to write the right codes to get it. So let's say this is from 2 decades ago. And then I would say from the 90s to 2000, it was the time of the Web 2.0, the second web. So Web 2.0 was in fact created for non-technical people to put data on there. Think about Twitter, Facebook, YouTube, Amazon. You can make a blog, you can make a website, you don't need any technology anymore. Anybody can do it. My kids can do it, right? So the thing there is, now there's a lot of data, and you know, I told you the variance. How do you connect this data? How do you know this patient data is true and does it relate to that disease or not? So that's Web 2.0. So now we have this volumes of data and more coming out. How are we going to wrap? So we need to go to a smart data. And this Web 3.0, the semantic web. And now to explain you semantic web, a little story which I use a lot to explain semantic web. And I hope I can put that seed in your head and you keep it. So let's say you want to go to Paris for a city trip with your girlfriend, boyfriend, or me with my wife. And I want to book a hotel, and I go a lot to the Hilton, so I got a lot of Hilton points, so I get free upgrades. And I got free Wi-Fi, probably bigger rooms for the kids, also good sometimes. So I said to my wife, okay, let's go to Paris and let's book the Hilton. So you can Google Paris Hilton. Guess what? If I do this now live, the hotel will be on page 4. Nobody clicks to the second page. Nobody even looks to the fourth link popping up. So you're missing out on your search. What do we do is a semantic search, and Philip will explain that later. And the semantic search, you add in to Paris Hilton, hotel, you add in semantics, I want to see the hotel and not the celebrity, and then you find the data. So this is what we do, we disambiguate your data. So our tool will tell you, not these are the pages and just click around or add in your words yourself. And if you know it, you'll find it. But if you don't know it, it's very difficult to find. And that's the point. Life science is not easy in all of these domains to know. So what we do is we will tell you, you know what, you got 300 million hits. There's so many hits about photos, pictures, or links to a celebrity who's female and called Paris Hilton, first name, last name. Are you interested in a celebrity, Paris Hilton? Are you interested in a company that's a hotel named Hilton, in a region that's a capital named Paris? So you see, you only will have like 5 to 10 answers, and then you click on it and you will get closer to the page 4 or the page 6. So this is where you apply semantics to your search to easily find your information, and Philip will show that. So the semantic web, also invented by Tim Berners-Lee, who invented the web, and I'm a huge fan of his work. So this is where Philip will take over and go into the demo and show you what it's really about. Okay, thank you.
So good evening. I didn't have the chance to introduce myself. So I'm Philip. I'm the scientific lead at Ontoforce, and I'm having a background in informatics and bioinformatics, and also in cancer genetics. So I have a little bit knowledge of both sides, and I'm the person who is, let's say, the interface between the customers, the users, and our development team. So I will try to explain you a little bit what we do and what the functionalities are of DisQover, of our tool, while doing a demo. So just a question first. Who is active as a researcher, as a student in life sciences? Almost everybody. And so who is going for a PhD or is in a postdoc position? Or is doing is a student and has to do some student work like making projects and looking up for data. So almost everybody, I think, in the room here. So typically, you all know you all have the same feeling. It can be very annoying to find the right information. And so, like Hans explained, if you are searching and you don't know where to start, you Google, and after 15 minutes you have like 20 screens open. A lot of decisions you made, you forgot how you did it. You took a first hit, second hit, you shut a screen, you typed in something in addition. So after a while you end up with a lot of information, and maybe the right information, but you didn't know anymore. You don't know anymore how you got to that information. And that's very annoying, because maybe next week or next month or next year you would like to repeat the search and maybe be sure that you can do the same thing again. And as a researcher, I think we all have a little bit the same habits. We are a little bit paranoid, because we would like to know, do we really grab all the information which is available, which is known for the moment. So we all trust on PubMed and other sources. But it's hard sometimes, because what you typically have to do if you would like to really answer a certain question, like a more complex query, you have to search in different databases. You have to cut and paste your information, and then after a while, you did some stitching work, cut and pasting work in an Excel, and then you have something, and then next month it's outdated. So that's very annoying, and that's sort of a monkey job. So you would like to focus on your research and maybe get a grip on being faster in accessing your information. So that's what we do with DisQover. So we try to make the life easier of a researcher in the broadest sense of the word. So it's also a researcher in academia, and it can be a researcher in one of the big top 20 pharma companies. But it could also be a dean at a faculty who wants to know who is the key opinion leader in a certain field, or who wants to know what are the sort of the trends going on in a certain field. So it can be anyone who is interested in life science data. So I will start with just explaining a use case, but maybe you can give me some input. Is there someone doing cancer research? And so on what type of cancers are you working? Any cancer. So can I make a choice then? Head and neck cancer? Someone else? Liver cancer. So maybe if I can make a choice, we can say, let's say take one of the big ones like breast cancer or lung cancer. So maybe take lung cancer, for example. And people who are a little bit familiar with cancer, with oncology or cancer research, there are some genes sometimes affected or really related to certain types of cancer. So, for example, we have a use case where you could say, yeah, EGFR is a gene. And in certain types of lung cancer, EGFR plays an important role. And we had a question by a user who says, yeah, I would like to know what are the brand names of the drugs used in clinical trials which are conducted in lung cancer where EGFR is important, and also which are in phase 2 states and where they are still recruiting patients or not yet recruiting patients. So it's quite a long question and you have to write it down. It's like a few lines. And actually, if you would like to start with that, you immediately think, yeah, I have to look for drug information, I have to look for clinical trial information, so it's rather complex. And we can go even broader. So I will show you how we do that. And that's a little bit new. So normally, if you are a little bit more advanced in searching in PubMed, for example, you maybe know the advanced button and section, and then you type in some keywords and you make a long query. And then you have your query, and then, yeah, that's it. Because, yeah, it's in one data source you're searching, but actually you would like to do this type of behavior in everything, in every type of, in every source. So we try to help you a little bit in making it easier by just doing it in a more graphical way by clicking and selecting and filtering. So I will show you. So I just type EGFR, and I hit enter. And so what Hans explained was this disambiguation, try to show you really what do you really need instead of going to the lady Paris Hilton, going to the hotel. We do this on the level of in the life sciences then. So I hit EGFR, and you see on the screen here that we have different what we call data types. So these are defined entities, concepts that we bring together. We have some funny logos maybe, but we are working on, or funny icons for the data types, but we are working on that to improve that. And also we will extend the number of data types in the future. But assume, yeah, we are interested in clinical trials, so I go to the clinical trials and select that one. And if I select the clinical trials, you immediately see that you get a number of widgets. So these are filters, and they are not only filters, they are also dashboards. So it's like a sort of a screen that you can manipulate a little bit yourself. So you can position these boxes like you want. You can make them smaller, bigger, etc. And I could start to answer my questions. So one of the questions was, I see here the study phase, and so I can filter that according to the alphabet, and then say, yeah, I would like to have the phase 2 clinical trials. And so just watch now what happens. If I click this, everything is recalculated. So it means that it's not only used for filtering and to narrow down your search, because that's typically difficult in life sciences. We all know that the tiny differences, the niches, the small details are very important sometimes to make a decision. Is this information really meaningful, yes or no? So we take here phase 2, and I say, yeah, also it has to be not yet recruiting, and it has to be also in a recruiting phase. Okay, so here I have limited my number of results, and I go here from 1,600 results to a little bit more than 200. I don't know if it's really visible on the screen, but believe me, it's there. And so also, yeah, very important, I would like to know what is the condition. So it has to be in lung cancer. But you have a lot of conditions here in the list because it's still more than 200 clinical trials. So I just say, yeah, give me all the lung-related diseases. I select all these. Everything is updated again. I can remove that words just to see the whole list again. And I also see where all these studies are conducted. And I can see other things too, like the lead sponsors. Who is doing the clinical trials? But yet, no, I'm interested in the drugs, so I go further. And I can even go into the results. And then here you have the list of the results. If I open that one and I go to the details, you see some data about the properties, the things which are characteristic for that clinical trial. And then also if you click on the data source, you see, oh, this is coming from clinicaltrials.gov, the American website, which is like one of the leading sources for clinical trials. And you say, okay, good, I have this, but now I'm interested in the drugs related to that. And that's the concept which is so new in what we do, and that's the semantic web and the linked data. You have here information about clinical trials, but actually if you click on this one, on this button, you see what is all linked to that. So these clinical trials with the filters I just said are related to a number of drugs. So I go for the drugs, okay? So I'm now in a new, let's say, world or field, because I'm now in the drugs or chemicals, and I can see even if people are a little bit familiar with drugs and with their classification, like ATC levels, this is an international way to classify drugs, I can even go to the antimetabolites, because yeah, I forgot to say that. The question was also, give me the drugs which are antimetabolites and used in that whole enchilada of clinical trials with all the filters you have. So I go for the antimetabolites. And the nice thing is now, I see here my drugs. And these are the two drugs, it seems, which are active or which are used in these clinical trials. If I now go to the data source, and that's also something which we try to do as good as possible, is trying to merge different sources together. So you see here that the data is fueled from Campbell, which is a European chemical database, Drug Bank, a Canadian one. Uni is coming from the United States, and also HSDB is a toxicology database from the United States. And so if I don't like something here, I say, yeah, maybe I have to change my words now. Normally I say, if you don't like the Canadians, you just shut out Drug Bank. Now I have to say, if you don't like the Europeans or the Americans, you shut out Campbell, and you don't see the information anymore. So that's very important for us. We don't claim that the data is ours or that we produce the data. You want to see where the data comes from, because that's very important. You know if for certain properties or certain information data is trustworthy at a certain source. So that's very important for us. But it means also, if you would like to see everything about that drug, that you could find this in 4 different databases. So if I scroll down, but now that this information is aggregated together in one place. If you think a little bit further, and if you continue to do that, because we now have approximately 60 different data sources in the system, we will grow approximately by 1 data source a week. We can cover a field almost completely with open data, with data which is provided or which is in the public space, which is accessible for everybody. So this is what you have here. So I have my drugs, but yeah, I was interested in the brand names and the manufacturers. These are the manufacturers. So my query was solved. Quite easy. I think in, let's say, 1 minute, I can go to my results. But now you can say, yeah, okay, yeah, I have my drugs, but maybe it's also important to know who is publishing in that field, who is working with these drugs, who is like, let's say, like a thought leader in that field. And then you can click on the links again and say, yeah, you have the 2 drugs after the filtering, and you have a number of publications. And here we are in a new world, again, publications. So yeah, okay, these are the publications, maybe filter away the publications which are a little bit older, give me the publications of the last years, and then you can see, if you open up your author list, these are the authors which are active in that field. Are these names a little bit clear for you? But for example, if you could say, yeah, okay, I am interested in that person, I click on that person, on the I symbol, and I get all the publications of that person. So I'm out of my field again of my 2 drugs. I was narrowing down my search. I was going to very tiny details, but now I can do a sort of background check of that person. I see what he was doing. I even see all the affiliations of the publications he was in it or co-authoring, and then also his activity or her activity during the years, and also even all the types of all the people who were co-working with them, with that person. So these are all the different co-authors. If I click on a publication, if I take one publication, and I just show these data source ID again, I see my data comes from PubMed. Okay, so we went to different databases just by doing a few clicks and show all things which are related to that. Again, now this is a nice thing. You see I made a number of hubs, and I can go to my overview and see, how did I do that? What is the story behind my search? So I just explained, if you do a search in Google, you can end up with a lot of problems and you make a lot of decisions. You don't know it anymore. Here we keep track of your search. And even we go one step further, you could say, yeah, this is dead ends. I'm not happy with that. Maybe I filter too much. I just go to my drugs again. I say, yeah, okay, these drugs may be filtering by these antimetabolites. That was not a good decision. I have to take everything, so I deselect antimetabolites. I get all my drugs and know, yeah, okay, I would like to go to the publications, which are now many more publications because I have more drugs left after the removing the filter step. And if I go back again to my overview, you see I branched my information. I took a branch in my thinking path. And you can even decide then, yeah, I would like to skip that branch, etc. You could even say, yeah, okay, no problem. I will go back to my clinical studies. And even say, yeah, I could even go to the first step again and say, yeah, no, I don't want to see the drugs, the clinical trials and the drugs related to that. I would like to see all the publications related to this EGFR. And then you have a whole bunch of publications. Again, if you double check it, you make a new branch. What we also have is always the possibility to export your data. So it's not a closed system, it's open, it has to be accessible as possible. So if you make a selection, you could even say, yeah, okay, I'm very interested in that information. You could select what you want or everything. So if I make a selection, I could say, yeah, okay, I'm selecting a few things now, so maybe only a few things. It's a little bit slow here on the internet. Okay, it's refreshing. And then say, okay, export this. And if it's a publication, you can even export it in the Medline format. And the Medline format, you maybe know that from PubMed. You can use this to enter then or upload your data in EndNote or Reference Manager, so a citation manager software that you can use to write a grant or a publication or a thesis. But also for all other types of data, it's always exportable as a CSV file, so something which can be opened in Excel, and you can work with that. The nice thing is, it's not just finished today, your search, we keep track of it. So it means this information that you see here, that I just demoed to you, you can see this again. I'm sorry, if I scroll up again, you can see this again here in all my past discoveries. So all my past work is kept here. And I can even share this. So if I say, oh yeah, I did something because I'm a specialist or I prepared something, I can share this with my colleague or with my friend. And then someone can collaborate with you. So it means that we try to bring data easier or at your fingertips and closer to you, that you don't have to consult a data scientist or that you don't have to be the hardcore bioinformatician to access your data. You see here just a glimpse of what we have. So you can even go further on that. You could say, yeah, we could add, for example, mutation data in that. So we have a roadmap with a lot of data sources in mind that we would like to add. And that's also part of the things we would like to ask to you tonight. If you start with testing the software and using the software, if you find something which you don't like or you miss, make a suggestion and we see what we can do for you. So I think we stop here for the moment, and then the next step will be, I think, the challenge, or that's in the planning. Yeah, okay. So I start the presentation again. Yeah. Okay. Is that? So I do that. Yeah. Okay. So Hans already explained to you a little bit what is semantics, and also mentioned Tim Berners-Lee as the inventor of the internet, and also the person who has the idea behind the semantic web. So we are currently in the second generation of the internet. So everybody is twittering and using Facebook. In the first phase, you were not able to add something. You had to write a code, a static page, and then you have to make some clicks or make very good keywords to be searchable by Google. But now, yeah, you just add your own data. We upload pictures, we add text, we interact with each other, we create new data on the internet. But in the third generation of the internet, that's what we try to do. We let machines communicate with each other. So it means that we let databases create information. And you have to envision this a little bit like an example with Wikipedia. If you would like to have a Wikipedia page about a certain topic, a physical person have to write the page. What we try to do is we try to bring data together, and it's not writing nice English sentences, but it's bringing together the ideas, the information about the concept from different sources. And so we create, you could say, Wikipedia pages automatically. And that's the ultimate goal we would like to go for, because that makes life easier and also will create a lot of information and will bring a lot of information together that maybe nobody have seen before, because you have a very specific search and you would like to see something about something, okay? So that's the third generation of the internet, and that's now popping up. That's gaining more attraction because people know now and also have all the problems with a lot of data, the overload of information. So we have to find a way to deal with that. I think we have a solution, or we have potentially a solution of doing that. So the term open data, I don't know if you're familiar with that. Is someone familiar with that? The term open data or linked open data? Nobody? So linked open data, that's a concept which is also supported by the semantic web. It means that you just try to be as open as possible, as accessible, or make your data as accessible as possible. And it means also that you have to structure a little bit your data. If you explain something, or if you list up something, or if you catalog something, and you do it in your own personal way, it's not that easy sometimes to interpret or to understand by somebody. It means that if you give a name of a list of chemicals, drugs, and maybe someone else calls it medicines and somebody else calls it active ingredients, and they mean all the same, yeah, you have to deal with that. You need to have a little bit of domain knowledge to understand this. So it means that if you would like to link things together, that you need something like a standardization. And it's a constant work. The world is not perfect, so there is a lot of data out there which will never be standardized. So there are some tricks, and we are applying some tricks to do that. But that's what we call an ontology. That's also related to the name Ontoforce. Is everybody familiar with the term an ontology? Who knows the term an ontology? So not that many people. So what is an ontology? It's like a sort of official classification and hierarchical classification of terms around a certain concept. So assume you have a disease ontology. As a pathologist who wants to classify diseases, he would like to look to organs and to substructures of organs which are related to diseases. That's a way of classifying diseases from very general terms, an organ, to subparts of an organ. But if you are a geneticist, maybe you look to diseases in the terms of genetics, and you would like to see, yeah, I would like to classify diseases according to the genetic defects which are related to the diseases. And so it means that you maybe will classify a lung disease with a liver disease, because, yeah, the same gene is involved. But what is the truth? There is no truth in that. The two ways of viewing or looking at diseases is just equally good. But we try to bring these things together, that people can communicate with who have different roles and different positions to be interacting with that. And so what is important for us, if you use DisQover, that you like to search data, that it's not something which is annoying or which is hard, that it's easier life, that you get access to that. So it should be, that's for us very important, that's a little bit the motto of the company. It should be simple as Google. It should also be nice looking, so slick as Apple, and fun as Angry Birds. Maybe Angry Birds, the hype is a little bit over, but still, it's something we would like to strive for. And these are some screenshots from the demo you just saw. So this is the beginning screen, this is just the start screen. This is like a first screen I just demoed to you, and this is like you see this filters. And so here are some quotes from people in the industry who really liked what we do, and who see a little bit the future in what we do. So I mean, I think everybody is struggling with the fact that you can't read all the publications which are appearing every day or which are published every day in your own field. So what to do with all the additional data which is becoming available? So we are just humans. We are not automatic robots who can ingest a lot of information. So we need tools to get structure in what we do. And that's, I think, the ultimate goal of what Ontoforce is doing. So I think the slides are a little bit skipped. So that's it. Yeah. So what I will now try to explain a little bit to you is, you've seen a demo. We can now afterwards interact more and do some further things on that. But if you say, yeah, maybe that's interesting, I would like to dig into that and try DisQover, we have an agreement with the people here who are organizing this, that if you list up your name or give your contact details to them, that they will send these information to us, and we will create an account for you, and you can test it as much as you want. The only thing we ask is that you try to be interactive with us. It means that we will organize every 2 weeks or every month a sort of webinar. You're free to join the webinar, so it's like a sort of moment that you have the possibility to just get online with us, get in touch with us, and ask your question and give your comments. Also, that we maybe will not spam you, we'll send you maybe a few emails to just ask what were you doing, are you using it, do you miss something? So it means also, if you have your own research or your own research projects and you miss something because you are using normally a very specific database or data source in your field and we don't have it, what can we do to help you? So it means that if the data source is open and it's available also for us as a commercial company to use it, we integrate it and we link it to all the other data. It means that we would like to strive for the idea that you don't have to use, or they don't have to go to other websites anymore, but that you use the data which is captured by DisQover. So we are in sync with every data source we have. It means that for data sources which are updated on a weekly basis or on a monthly or longer basis, that we are completely in sync, and for databases which are, let's say, updated daily, that we have a delay of a few days. Okay, so that's a little bit the challenge. We would like to invite you to be part of the DisQover family and to start with DisQover and try to see if you can do your searches. And if we can incentivize you a little bit with doing that, we will make some, let's say, some competition in that. If you say, yeah, I've solved a certain use case, so I had a problem, it was hard for me to solve that, and you can explain to us, yeah, I solved this using DisQover, we will make a selection of the best use cases and then hand over some prizes. So I think we still have to decide what to do, but it means that we will sort of give away, for example, an iPad or something to people who are really active in that, because we need the feedback just to improve the product and also to help you out, that you also fall in love with the product and would like to use it in the future. So thanks.
One thing, so the challenge is the person who comes up in the next month and a half, 2 months with the best use case, and we want something that helps you, will have a prize, and let's say it's an iPad at this point, I will then disclose to you. But this is not to win the iPad, this is an incentive, right? We want you to be happy and to use the tool. So who wants to use the tool now after seeing this? Oh, that's plenty, cool. So be sure, you can spam me and Philippe. We won't spam you, but you can spam us. Okay, so don't worry about that. We're on Skype. Try to do this, and this will be helpful. So the first challenge will be that, the best use case. The second challenge will go a step further to curate your own data and your own publications and stuff like that. But let's take that as a second step after this one. So thank you very much.